Hi, Dr. Nicholls. Thank you for taking the time out to do this interview with us. Cervical cancer is the second leading cause of death for women in St. Vincent and the region. What can be done about this?
We as healthcare providers have always advocated that women should have their pap smears regularly. We normally advise our women that once they start having sexual intercourse, that 1 year after that we will offer them their pap smears, or they should come in to have their pap smears done. Before the vaccine, the pap smear was our way of determining if there were any abnormal cells at the cervix, and therefore if there are abnormal cells, we can treat appropriately, hopefully reverse the process, and then they have normal cells again. Bearing in mind, because the HPV virus is the cause of cervical cancer and other cancers, the virus actually stays in the body. So you may treat the patient and the patient may actually go away thinking they're cured, but because the HPV virus is still in the system, you can get abnormal cells later on. Hence the reason you should be doing your pap smears as the doctor advises you to do it. We vaccinate them before they start having sex. Once they become sexually active, they still need to continue, they still need to do their pap smears. Now remember that HPV is normally sexually transmitted. Okay, so by offering it before they start having sex, you are hopefully getting to diminish the incidence of cervical cancer. Not because they have been vaccinated means that they will stop doing the pap smears. It's going to be it will work in conjunction.
Who all can benefit from this vaccine?
Ideally, both boys and girls will benefit from the vaccine once they haven't started having sexual intercourse. It has been shown that they can get benefit because you can get benefit from preventing cervical cancer, vaginal cancer, anal cancer, penile cancer. Okay? Our program in St. Vincent is just being launched, and therefore we are going to start with our girls. And right now, you're just doing grade 6. It is my hope that the program will expand so that all girls who haven't started having sex will benefit from it, and also the boys. Having said that, there's research that shows that you can have what's called a catch-up program. So even if the girls have started having sexual intercourse, they can benefit from it, because you also realize that they may not have had 3, 4, 5, 6 sexual partners at an earlier age. So you have a 16-year-old girl, she has one sex partner, she may be able to benefit from it at some point.
In a case where persons have had multiple sexual partners, is it that the vaccine would not be beneficial to them?
They have already been exposed, and the more exposure you have, the vaccine will not benefit them, because once you have the virus, the subtype, HPV has several subtypes. Okay, not all of the subtypes are cancerous. So what we need to do is to catch the girls before sexual activity. The more sexual partners you have, the more exposure you have, and therefore it will not be as beneficial as if they get it either before sexual intercourse or if they've just started sexual intercourse.
Concerning this HPV vaccine, we know that the prevention of cervical cancer is the greatest selling point, but you have naysayers. Why should persons listening to this interview be convinced that this vaccine is good for them?
The studies have shown that it has made a big difference in countries where it's been used, for example in the United Kingdom. I personally believe, and I've been a healthcare provider for over 25 years, working in obstetrics and gynecology, that cervical cancer is preventable. And if we can stem it, if we can find something to decrease the chances of cervical cancer, I'm all up for it. As I said to you, I have passed this information to my friends and family, and some of them have actually gone ahead. They've done their research and they realize that it is of benefit. Anything we could do to stop the scourge of cervical cancer will help us in St. Vincent. When you get cervical cancer, it's gone, it's really late. In other words, we have missed the boat where we could actually help you. We do not have radiation therapy in St. Vincent. We do not have chemotherapy. Well, we have chemotherapy to some extent, but radiation therapy is not available here. The cost to do radical surgery, the cost to do radiation therapy is exorbitant, and most people cannot afford to finance that. And therefore, once it's like a death sentence, basically. And if we can stop or decrease cervical cancer, now with the vaccine and by doing regular pap smears, we are empowering ourselves as women to ensure that this disease can be eradicated in St. Vincent and the Grenadines. Parents, guardians, I implore you, prevent cervical cancer, save our Vincy girls, get them vaccinated.